The district nurses at Kilmeny look after patients with all sorts of long-term conditions within their own home environment, looking after some chronic disease management through to acute post-op wound care. We're not just looking at a patient with a condition, we're not going to a wound care, we're going to a patient with a wound, with a family, with carers.
You've got to look at not only the patient, you've got to look at their circumstances as well as all the other conditions that they're dealing with, whether that be social conditions, financial conditions or actually just their health implications.
I nominated the Kilmeny District Nurses, particularly because they do stand out. I think particularly under the leadership of Ruth Thomas, I think they offer a very patient-centred approach. I think they take into consideration the needs of carers and they're very holistic in their approach to delivering care.
Oh, they're great. I look forward to them coming every day. They come in the morning and they just do me insulin up at night and I do it myself. And we always have a laugh, don't we? Even if we're miserable, we have a laugh. I'm doing too bad, I'm after 90.
I think it'd be great if the Kilmeny team won the award. I think in recognition of all the hard work, they certainly go above and beyond.
If we won the award, I'd feel extremely proud as a team leader for the people that I work with, who always go the extra mile for people.
I can't fault them, they're marvellous. I don't know what to do without them.
Family Nurse Partnership help first-time teenage mums that can often be thought of as maybe being reckless or they're not worth it, but it actually puts a lot of time and effort and support into those mums to make them being the best mum that they can be.
We work with pregnant teenagers from when they find out that they're pregnant until their child reaches the age of 2. And it's an intensive home visiting programme specifically designed to focus on young people. Parents will have just one family nurse and what we try and do is be a role model, somebody who's dependable, reliable, somebody who sort of is there for them whenever they need it really.
The programme is about changing the world one baby at a time. The window of pregnancy we know gives an opportunity for women to make changes. Women want to be, and young people want to be the very best parents that they can be.
I'm Stacey, I'm 18 and this is me and she's 10 months old. But having a family nurse has been really good because they're there for like a long time, they're there to help you through your actual pregnancy and then helping you get to where your goal is really. If I didn't have a family nurse, I don't think I'd be the mum I am today. I don't think I'd be in college and wanting to go further than what an ordinary mum would want at my age.
I think that the nurses strive to provide the best individualised experience for their clients that they possibly can do. And I think that deserves some recognition. I'm very, very proud of them.
Well, the idea for the recipe book came about through our safe swallowing training, which is a training session for carers who are working with people with swallowing difficulties. A lot of the carers were struggling with ideas that make the food varied, tasty, that look good, that are nutritious. And we thought by doing a recipe book it would really help carers provide a range of different tasty, nutritious meals that are also safe, that meet speech and language therapy guidelines for consistencies.
Myself and another student went out and we watched people eating recipes from the book and interviewing the carers. One thing that really emerged from the study that we did was that presentation is really, really important to our service users, especially when you're on a blended diet. Everything comes out brown, and this recipe book is absolutely brilliant because it does actually address the issues of presentation.
I nominated the team because I truly believe it's a unique resource. It's a resource that ensures that once we give recommendations to carers and service users around making their food and mealtimes enjoyable and safe, that we actually give them the skills for them to be able to do that themselves.
It feels amazing to be nominated for the recipe book, to know that this booklet hopefully has improved the eating experiences and quality of life of people that require modified consistencies.
I believe this book should win the award because it is a voice to people with severe communication difficulties and learning difficulties. The people that we work with don't have a voice to tell us how they feel about food presentation and about what they're eating.